Hello. Hi there. Got some privacy. My name's Aaron. I'm a student nurse that came to fix your or replace your trach today. Is your name Wayne Smith? And your birthday February 13th, 1950? Okay, great. I'm gonna do some hand hygiene. I already put some PPE on. I'm gonna finish that by putting on these stationary gloves. I'm gonna raise you up to a good working height. I already set up some supplies earlier and on the bedside table. So before I take off your mask, I'm gonna hyperoxygenate and then remove that. Set that to the side. Remove your old drainage gauze here. Note the characteristics and what's on it and such. Toss that in the trash. And I'm going to take off my stationary gloves. Toss them. Open up some supplies here. Oh, no, before that I would have done some hand hygiene. Open up. Open up. And I got some saline solution that I can open. And for our purposes, I'm not going to take this off, but I would take it off, maybe do a little lip, and then pour some in that tray, the empty spot. Recap it and set it to the side. Now I'm going to take off my stationary gloves. And open them up. Let's put those on. Okay. Now that I have these on, I'm going to well, what I would have done is take out the trach tube that should have been in here by clamping it and pulling it out at a counterclockwise. So I would have pulled that out and tossed it in the trash, which it's already down there. It's okay. Alright, so next thing I'm going to do is start cleaning. So I would clean the area away from me first, getting around it and under it, making sure I get a bunch of those secretions. If necessary, I would do more than one. There's plenty of swab sticks in here. Come over here and do the area next to me. Under it and around it. Okay? Swizzle, toss. Next thing is I'm going to get my gauze, make it into a little poof. Oop. Okay, well I wouldn't use that one. Let's say I've got more in there. Dip it in, squeeze it out. Come over here, clean the outside plate. Swizzle, toss. New gauze. Be careful not to drop it this time. Poof, squeeze. Clean the outside. Take as many gauze as necessary. Swizzle, toss. Alright, now I'm going to place the new trach tube into the patient. Start kind of at an angle and move kind of clockwise into the patient. Click it in place. Now I'm going to start with the new necktie. Kind of straighten it out a bit. I want to grab, I know the name of this. Whatever, this thing. And you want to start on the side that's already tied, so I'm going to be working on this side here. Pull it through here. Okay, pull it through like so. Straighten it out some more. Ask the patient to lift his head and then pull these around. Straighten those up a bit more. Well, come on, Mr. Smith. Let's raise that head some more. Okay, and then pull another one of the ties through. it's locked in place. And the sterile part of the procedure is already over, so I didn't need to change my gloves earlier. I'm going to tie this in place, not too tight. Make sure he's got plenty of wiggle room, just enough to keep the trach in place. I'll keep that on there. Now I'm going to get these again, come over to the other side. And I'm going to gently take it off of there. Okay. Okay, I would have him raise his head one more time for me. We're going to pull out the other bandage. Alright, and I would swizzle toss because that's probably disgusting. And I'm going to replace the drainage gauze thing. Put it under my patient because I can't remember the name of stuff. Secure that in place. Okay, now that that's done, I would clean up my supplies first. Get this off my patient. Take off my gloves first, because now we have to show taking off PPE. Toss those in the trash. Start with the mask next. Take that off and put it wherever appropriate. Start with the mask next, starting with the bottom tie, which mine was pretty tight, and then the second tie, because you don't want it to flop all around you. No, I have to start with the gown first. Okay, well, I didn't start taking my mask off first for our purposes, because I would have caught that. Okay, fold it up away from the body, toss it, and then my last tie, which, just have to rip that off, and then pull it away from the patient. And before all of that, I would have lowered my patient, asked him if he was comfortable, if he needed anything else, and that would have been clean, and I would have been out of the room. And that's Trach Care.